Hi, Mrs. Smith. My name is Cameron. I'm going to be your nurse today. Could you verify me your name and date of birth? Awesome, thank you. So the doctor put in an order for a catheter, so we're going to put a tube into your bladder to relieve some of that pressure you're feeling. Do you have any questions? All right, so we're going to go ahead and get started. So I'm going to pull the sheet down, keeping in mind to give the patient more privacy. So I'm going to drape it, and I'm going to do the same in their gown to drape it to give them more privacy and keep them comfortable. Then I'm going to assist the patient into a dorsal recumbent position. There. Then I would wash my hands, and then I'm going to put clean gloves on. And I would grab soapy water. And for the purpose of this video, I'm going to use the same washcloth, but in real life, I would use different washcloths to do the different steps. So first with soap and water, I would wash the far-sided labia, and then I'm going to wash the near-sided labia, and then I'm just going to go right down the center over the urinary meatus. Then I'm going to rinse that with water. Doing the same thing, going front to back over the far-sided labia, and then the near-sided labia, and then right down the middle. And then I would dry it a little, and then I'll move this over here, and I'll take my gloves off and wash my hands. Next, I'm gonna open up my sterile field, and I'm gonna just take it out. I'm gonna use this bag for a trash bag, and I'm gonna put it at the end of the bed so I can have something to throw it away without putting my back on the sterile field. And I'm gonna set it up so I can use it without going over my sterile field. So first I'm gonna open my sterile field with the 1-inch margin. So you're gonna go out, making sure, keeping in mind the 1-inch margin again. And I'm gonna open it like that, making sure it doesn't touch me, and using the 1-inch margin, I'm just gonna reposition it and a little bit over so I have room to put on my sterile gloves. Then I'm gonna take the sterile drape out, keeping in mind again the 1-inch margin. Then I'm gonna ask the patient if they could raise their hips. For the rest of this video, it's a little difficult because it's a mannequin, but I would raise their hips and I would put it under the buttocks. And I'm breaking sterile field in this video just because you can't really get it under them without the 1-inch margin. So with that in place, reposition that a little. I'm gonna put my sterile gloves on without contaminating the contents in the package. And that is just trash. Now I'm open my sterile gloves using, again, the 1-inch margin. And if this were to touch my sterile field, that would be considered contaminated, and I just put my hands over it, and that's also considered contaminated, and I would restart. So I'm gonna put my sterile gloves, only using the cuff. And then I'm gonna put my other glove on. This is not being very compliant. But now that I have that glove on, I can move my gloves around, I can touch sterile to sterile. All right. So now I'm gonna take out my unneeded products, and then I'm gonna take my fenestrated drape, and I'm gonna cuff it around my hands so I don't break sterile field. And I'm gonna put it over the patient, making sure not to touch them, because if I were to touch the patient, it would then be considered contaminated. Then I'm gonna take my betadine and I'm gonna put it over my swabs. For the rest of this video, we're not gonna use this because of the mannequin. Then I would discard, and I'll put my lube into the tray right here. Then I would discard that. And then I'm gonna put the lube on 1 to 2 inches of the catheter. Then I'm gonna pick up my tray and I'm gonna put it in between the patient's legs, keeping in mind not to break sterile field, and that just fell and I would restart on a new catheter kit. So, I'm gonna use a swab first, and I'm gonna spread the labia and also pull up. And I'm gonna wipe the far sided labia, and then I will discard, making sure not to go over my sterile field. Then I'll wipe the near-sided labia front to back again, and then I'm gonna go right down the middle. Then I'm gonna move the catheter a little bit slower, and if the labia was to go over the urinary meatus, I would stop and I would rewash the patient and redo the procedure. And then sticking the catheter in, if it was to go into the vagina, I would leave it and I would insert another catheter into the urinary meatus. And if the catheter touched the linens or the labia, I would then restart. So I'm gonna move my tray a little closer, and I'm gonna insert it 2 to 3 inches. And then if I feel any resistance, I'm just gonna slightly twist it. And then I'm gonna insert, when urine starts flowing, another 1 to 2 inches. And then when urine stops flowing, I'm gonna grab the catheter out, bunching it up in my hand, and I'm gonna discard of the catheter using universal precautions. Then I'm gonna pull my tray out and I'm gonna put it to the side, making sure not to throw it away so I can assess the amount, the color, and the clarity of the urine. And then I can discard of the drapes using universal precautions. Then I would grab soap and water, and I would wash the patient again, going front to back with soapy water on the far-sided labia, and then the near-sided labia, and then down the middle. Then I would rinse it with just plain water, again, the far-sided labia, and then the near-sided labia, going front to back, and then down the middle. Then I would dry it, and then I would put this over to the side. I would take my gloves off, wash my hands, and I would cover the patient up for privacy, assist them back into a relaxed position, cover them up, and I would document my findings, give them their call bell, thank them for my time. And then if I were to do this on a male patient, I would retract the foreskin using my non-dominant hand, and I would hold it at 90 degrees, and I would clean in a circular motion using the antiseptic swabs around the urinary meatus and down the shaft. And then I would lube it 2 to 3 inches, and then I would insert it 5 to 7. And then once urine starts flowing, I would insert it another 1 to 2 inches and ask them to bear down as I put the catheter in, as into void. And then I would document my findings.